Hi, welcome to today's Executive Update and Q&A session. I'm Chris Haynes, Deputy Head of Communications, and I'm here for Yolanda Martin, Associate Director of Communications and Engagement. Today, joining John Brewin, Chief Executive, we have Anne-Maria Newham, Executive Director of Nursing, AHPs and Quality, and also Lorraine Hooper, Executive Director of Finance, Information and Estates. If you haven't joined a session before, we've had some questions submitted in advance, but feel free to pop a question in the chat if you want to ask one, and we can ask that for you. I'll now hand over to John to give us an update.
John, you're Donald Duck again. Yeah, you're proper Donald Duck. You haven't done that for a long time. So for everybody on the call, I'm so sorry. So what happens very, very occasionally, it used to happen a lot to Dr. Brewin, where he came on and he was proper Donald Duck for quite some time. Now we're a bit kinder to him and we tell him within a minute. Whereas if we'd have left him a bit longer there, that wouldn't have been great. So what we find is if he drops out and drops back in again, he seems to be able to have a better voice. Let's give it a go. Go for it, John.
I get self-conscious now because you take the mick out of me.
That's worked.
Oh, sorry about that, everybody. That hasn't happened for ages. What I was saying was thank you very much, Chris, for that introduction. I had hoped to be able to stuff a bag of crisps in between my last meeting and this, but unfortunately I've not quite finished the crisps. Good, got some good questions today. As Chris said, if any other things, pop them in the chat. You're all very welcome. There's a few headlines, updates before we get into the questions. The first thing was to note the funding announcements yesterday from the government, which I think irrespective of your political persuasion is good news for the NHS, and it's good news for social care. We might have views about whether it's enough or whether the method of finding the revenue is the right one, but I think given the straits that we're in right across health and care services, it's good news to be receiving some additional funding. And I know Lorraine will. Thanks, Anne-Maria. That's a really helpful comment in the chat. I know Lorraine will be working with her regional and national colleagues about exactly what that means for us and the exact amounts. But good news all the same. Some further good news and some thank yous to everybody on the call, both sort of personally, but also for the leadership you're providing around managing continued management of the pandemic and all things related. I think we said a couple of weeks ago that our figures on staff vaccinations are really positive. We're up around 95% now, and relatively small numbers of staff that have chosen not to have the vaccine. But thank you to everybody that has. And like we always say, that there's still plenty of opportunity to both ask questions and find out further information about vaccines if you're still not sure, and receive the vaccine if you're minded to. In relation to pandemic related things, still in terms of lateral flow tests, again, good news on the numbers of people doing regular tests and reporting. Still urging people to make sure they're aware of how to do that and to keep encouraging reporting on the percentages. Although they're going up, there's still some way to go, but thank you to everybody that's doing that now. But to note as well that we are receiving more positive tests on lateral flows. And you'll see what that means, won't you, when on the news and in the media that, you know, cases, average numbers of cases still continue to rise. And there is expectation that that will continue to be the case based on both the bank holiday, long bank holiday weekend, but also as schools start to go back. That's certainly the pattern they noticed in Scotland, where they've been back a couple of weeks. And I think that's as much a watch this space over coming weeks as to whether there's any changes to sort of national policy and guidance at the moment. I think it's clear, isn't it, that whilst whatever possible can be done to avoid going back into lockdown, there is a possibility that we might see some restrictions back into large gatherings, for example, but that's for the future, and we're just going to have to see how the numbers go. At the moment, we're not changing any of our guidance around social distancing, PPE, etc. Just a couple of things non-pandemic related. At exec meeting this morning, we signed off the rewrite of the sickness policy for the organisation. You might think, why is that important? It's one of those things I've had a sort of steady trickle of concerns from right across the organisation over the last year or so, feeling that it was outdated in as much of the language that was used around it and didn't really chime with our new culture and values, and was seen to be fairly target driven. And that's with a wide range of consultation across the organisation now been rewritten, and I think it hopefully will land well. There's going to be more formal, not formal, official launch, and the opportunity to connect with some training sessions for managing leaders to make sure that everybody's up to speed on the content of that. And then finally, a couple of things for diaries really in over the next few weeks. October is Freedom to Speak Up month. We've done a lot of work across the organisation on speaking up more generally. There's still some distance to go, but I think it's becoming more broadly engaged with people, and hoping that it's seen as now much more positive function that enables people to raise issues, concerns, positive things as well, and to get quick local resolution. There will be a series of webinars and opportunities for people to have conversations with our 40+ FTSE champions. So watch out for information about that in messages and on Connect. Similarly, I'm not sure if it's hate crime week or month. I think it's week, isn't it? First week in October. There's Amaria will correct me on this. But again, we've put a lot of thinking and resource into how we can support and promote this across the organisation as posters. And again, there's going to be some access for training for staff to help get cited on some of the issues and what we can do to see it, report it, and stamp it out, and not tolerate this. So there we go, 7th of October is the week. So, and again, more information in the messages and on Connect on that. So there's some of the headlines I just wanted to get over to you. And then, as ever, a huge thank you for what everybody's doing. You'll know that the system is really hot at the moment. Both acutes have declared what's called OPEL 4, which is the highest level of activity stroke pressure, and it's mirrored across all sorts of different services. We're not the only system by a long chalk, but it's really, really tough out there. And I know I say this on a regular basis, but it's very unusual, if not unprecedented, for us to be like this in September. So thank you for all that you're doing. So that's my intro over with Chris. I'm going to hand back to you to start to take us through the questions, unless there's anything specifically in the chat that's come up. Thanks.
Thanks, John. That's really useful. Yeah, just a couple of bits. Anne-Maria's just put in, it's the 9th to the 16th of October for the Hate Crime Awareness Week. Just looking through the chat. Okay, that's fine. I'll move on to the questions then. So if the first one, John, if I could direct that to you for an answer. So it says, in the last Q&A session, it was said that the Trust is not doing immunity testing on double jab staff, but then that being jabbed is the best thing that you can do to protect yourself and those around you. What studies or data is this based on, given that no immunity testing is being done on double jabbed staff? And what data is being used to compare jab-induced immunity versus naturally acquired immunity?
Yeah, thanks, Chris. We touched on this at the board meeting. There was a similar question that I answered, and I'm going to answer it in a similar vein today. That I suppose before getting on to the specifics, it's just worth re-emphasising the fact that we're still very much under instruction here as a NHS trust, even though we may think foundation trust makes us semi-independent, but we are really tightly held to account by making sure that we abide by all these missives and instructions that come from whether it's Department of Health or NHSE, and particularly in relation to the issues within the pandemic. So Anne-Maria will be able to talk chapter and verse about infection prevention and control rules and regulations that we have. It's not true to say we don't have any say in, but we are instructed to do A, B, C, D and E, and we're expected to do that. And it's similar in the vaccination programme. So though I keep saying it's not mandated, we are expected to make sure that we've got a robust vaccination programme that offers vaccinations to all those that are eligible in the right order. The detail around the specifics of immunity and levels and reducing levels of immunity and what the Trust's view is on the research and the data, we might have a view that the national committees, Public Health England, the JCVI and others might not. We might think, well, that's not all the data, or they've reviewed the wrong things, or they've come to the wrong conclusion. But to be blunt, what we think on that is largely irrelevant. We will and do as instructed. And I think it's really important to get that clarity across, that we won't be doing immunity tests on staff, but there will be national research that has done that, and the research is published, and people that are experts in this, particularly in Public Health England, will be able to answer some of them as more specific questions. But and the other thing that is important to say about particularly vaccines is that there is a robust safety methodology around side effects in terms of reporting and learning from national stats on that. So, for example, there are some people you may have seen in the conversation around 12 to 15-year-olds that the reporting internationally has suggested that there's an extremely low risk of heart problems with the vaccine, and that's quantified, and that's due to the really robust reporting measures that have informed that. And that pertains right across the use of vaccines. So I'm assured that we've got good processes in place that we use in safe and effective medications in this instance, and that we won't go off our own bat and start doing specific immunity testing or related things that because it will have no impact on what we're expected to do. So it's a bit long-winded, but hopefully that gives just a bit of a flavour of the environment that we're working in on this. Thanks.
Thanks, John. Okay, the next question we have is, have we heard yet about the COVID booster programme? So perhaps, John, if you could answer that one.
Yeah, thanks. So still on vaccines, hopefully at some point we'll be talking about some other things, but it's a really good question, and I suppose in some ways it does relate to the previous question, in as much that some of the research evidence is now suggesting that people's immunity starts to decrease over a period of time, and that will depend on so many different factors in terms of whether that's an immunity from having been ill, or from immunity from having received the vaccine. The different vaccines that are being used, there are at least 3 now that are being used fairly widely, and also people's own health status in terms of other comorbidities, etc. So there's talk of booster programs. We're expecting at any time further announcements on this and what it will entail. There's a lack of clarity on excuse me, whether it'll be 1, whether it'll be 2, whether it's a different vaccine from the vaccine that people received the first time around, etc. And there's also conversations and discussions about who are the people that will be eligible for this. Will it be the same order of cohorts as previously, starting with the most elderly and working down? What about the clinically extremely vulnerable? So we're expecting it, we've been expecting it for some time, but at the moment we're still awaiting confirmation. I think I've probably covered that answer. So yeah, no need to do anything yet in terms of thinking whether you need to book. We'll let you know when we get information on it.
Okay,
thanks.
Okay, so the next question, still on vaccines. Maria, if you could answer this one, please. So I read that mandatory jabs might be introduced for NHS workers. Do you have any update on that?
I'd love to be able to tell you a real definitive answer, but I'm so sorry, we do not know. I've heard the same. I hear the same on the media, social media, people saying, oh, NHS workers are going to have it. We don't know. We genuinely don't know at this point. The only thing we know is it is mandated for staff that are going into care homes, and they need to be double jabbed by mid-November. But for ourselves, we have still not been given any instruction on that. The other thing I think is worth noting, because sometimes we get quite a lot of questions through, myself and John often have to answer questions on these subject matters, and our opinions don't really differ. We have exactly the same opinions of these things. We're told what we have to do by Public Health England, the JCVI and NHS England, and we adhere to the advice that we are given. So at this moment in time, we're not hearing anything. I'm hearing possibly the same as everybody else, but we've got nothing definitive coming down to us.
Thanks, Anne-Maria. Okay, so the next one, perhaps if we stay with you, Anne-Maria, actually, is there now a single Trustwise seclusion and long-term segregation procedure?
Oh, that's a very good question. I love questions like this. So at the beginning of 2020, before COVID, it became very apparent and very clear that we had hundreds of clinical policies. And what also became very apparent and very clear at that point is we had lots of policies that varied dependent on where you worked and which division you worked in. So sometimes we could have 2 divisions having different policies for something very, very similar. So what we did is we kicked off a piece of work beginning of last year, April time. We kicked off a piece of work to look at all the clinical policies, to see whether or not we could rationalise those hundreds of policies we had. And there's a working group, a really good task and finish working group that is chaired by the Deputy Director of Nursing, to look at all the clinical policies and to see if we can bring any into line so that we can have trust-wide procedures rather than having singular for a division. And so, yes, there is now a single trust-wide seclusion and long-term segregation procedure. I suppose it would have been dead easy for me just to say yes, but I wanted to explain how we got to that position in the first place, is that we've done a piece of work to try and help staff to know that there are only much fewer policies than we originally had. I did see Sue come on, so I didn't know whether or not she wanted to say anything else about that, but that's the short and long of the answer. There she is. She's also managed to have something to eat. So, Sue, did you want to add anything to that?
No, I think it's a really excellent piece of work, and I know that our division has lots of separate policies and procedures that we're working hard to align and make into one trust-wide where possible.
Thanks, both. The next question I was going to direct towards you, Lorraine. So what are the annual leave overtime remedy payments, please?
Okay, so some of you might be aware of an employment tribunal that's been going on for quite a few years, actually, known as the Flowers Tribunal, which was named for the person that brought the case against East of England Ambulance Service, and it's about whether annual leave is owed to those that do regular overtime. So that went all the way through a number of our courts, actually, and that individual Flowers won their case. Nationally, then, there was lots of work done on what that means for NHS staff, what payment should be paid to those who undertake regular overtime. A national agreement's now been made, and a national calculation has been undertaken. So our payroll teams have transacted that national calculation through, and for those that are entitled to that payment under the terms of that national agreement, that will be paid in September's payment run. So there's, as you can imagine, a huge amount of really technical detail behind all of that, but there are some more details about that on Connect if you need it. If you think you are eligible for a payment and you don't get one, I'll drop the email into the chat that you can contact, and they'll be able to look into that for you. But yes, now has reached a resolution and should turn itself into payment for those relevant individuals in September.
Great, thanks, Lorraine. So this leads us on to the final question that's been submitted in advance, but there's a few that have come up on the chat, so we'll move on to them in a second. So this one, I was going to ask you, Lorraine, but I don't know if Sue, perhaps now you're on the call, you might want to answer, but you can decide once I've read it out. So could you please inform us when Rampton Hospital swimming pool is opening up for our patients? Also the reasons why this couldn't be managed with the specific measures in place to manage COVID, like this has been managed in the community.
Shall I do it then? Mm-hmm. Okay. So it's not simple. It's not related specifically to COVID, actually. There was, people will be aware across the trust, there's been a lot of staffing pressures. And my HR director colleague always talks about the pindemic. Is it pingdemic? How do you say it? And I think we've all struggled with that, particularly I know at Rampton we have, in terms of the number of colleagues that have not been at work, and that's simply the reason. So we've had to redeploy a lot of non-nursing staff out back to the wards, a bit like we did in the sort of early days of COVID. And then behind the scenes, there's a lot of work going on in terms of getting staff trained in terms of being lifeguards, etc. So there is a plan. I can't tell you the date, but it's not a COVID directly related issue. Thanks.
Thanks, Sue. That's really helpful. So there's just a few either comments or questions in the chat, John. So if I just have a look through those. The first one, perhaps Anne-Marie, you might want to comment on this. So there's just a comment in the chat that we've seen an increase in hate incident reporting over the past couple of months. So that's just in response to the Hate Crime Awareness Week that we were talking about.
Yeah, happy to answer that. So Robert makes a really good point on describing we have actually seen quite a big spike of incident reporting, but I want to emphasise the word reporting. So what I think it is that we are so much better at supporting staff to report it. So we think we were under-reporting previously, and that's why we've seen a spike for June and July of this year. And actually, I welcome that spike. I welcome the increase, because that's about saying to staff, we take it seriously. When you want to report, we will do something about it. And it's good for us to know that, because otherwise it's a hidden problem and we don't want it to be hidden. We really want it out there. When it comes to the awareness week, you know, we've got some fabulous posters, we've got an MST background, we've got some additional training that we've commissioned. We really want to support staff in this very difficult agenda and how people feel about working in the organisation. You know, that was one of the things around the staff survey. People said, you know, they wanted that response. So it's, you know, you said, and we have absolutely done something about it.
Thanks, Anne-Maria. There's also a comment in the chat, perhaps, John, you might want to answer this one. It says, what do you think about the announcements yesterday? And then the person's view is it's a sticking plaster to cover a gaping hole.
Yeah, hi Neil, thanks very much for contributing. So, as a reference right at the start, I think to sum total of the money announced is really welcome. I know that organisations like NHS providers have said, you know, it's probably less than half what we need. However, so my view is, I think, given the reporting we're getting about the conversations around what's called the National Spending Review between Department of Health, Treasury and all the other government departments, apparently it's a huge bun fight, and the fact that we've managed to secure that amount is good news for health and social care. And when I'm asked about this, I often remember a quote that stuck in my mind, not the person that said it, I can't remember who it was, but there's a bit of a paradox in the way that the NH is, just in terms of its being. One is that on the one hand, it's never got enough money and is always scrambling around for cash, but on the other hand, it's very inefficient and it's got very high levels of waste, and both those things are true at the same time. So whilst it will be relatively easy to evidence, you know, gaping holes and services that aren't properly resourced, I think it's really difficult to evidence that we're doing all we can to reduce waste and be as efficient as we can. It's always nice to have more money, but I'm just a bit concerned that we're going to end up, if we're not careful, not in the trust but nationally, with having money that we can't spend because of the massive challenges we have about recruiting and retaining staff and encouraging people, and particularly young people, to come and have a career in the NHS, you know, which we all love and worship. I've spent all my working life in the NHS and I think it's an amazing institution. I use that word in the positive sense of institution. It does so much good. But you know, we know some of the challenges, don't we, in terms of the demands of the jobs and what alternatives are going to be available, or already available, are going to be available in the economy over the coming months and years. And it sort of begs the question, why would people want to come work in the NHS? And I think that's really sad. And we need to guard against getting into a position where we have got cash stacking up that we can't spend because we can't recruit. Is it something like 2/3, 3/4 of our spend is on staff in the rain? Lorraine will know the exact number. So I probably equivocate, Neil, and say it's more than a sticking plaster. I think it's quite a significant amount. and doesn't quite leave us with gaping holes. But that's my view. Hope that helps. Thank you.
Thanks, John. So the last question in the chat is the 2021 NHS Staff Surveys fast approaching. Do you think as a trust the results will show improvement when compared to last year's survey results? So if you perhaps want to answer that one, John.
Well, shall I start? I'd be interested to hear what Exec Wall and anyone else thinks, really. So to start, we were the most improved organisation nationally last year, which was a phenomenal achievement. And we, I think, improved significantly on 9 out of those 10 headline domains, which was brilliant. But we were in unprecedented times, and lots of other organisations had quite significant improvements too, although we were better than everybody. One of the things that really contributed to that was, as well as the programmes we're putting in place and the work of staff, was the response rate. So the response rate went up from something like 43% to 54, 55%. And as the more people you can get to respond does correlate to more positive scores, because there's a truism in this work, and backed up by research, is that the vast majority of people, or perhaps not the vast, the majority of people, often a silent majority, often don't contribute to these surveys, even if they've got positive things to say. And you tend to get sort of skewed reporting if you don't put in a really detailed programme of engaging people as to the reasons why it's important. This is the most important feedback I get, essentially, about being a chief executive here, and what everybody thinks of the organisation and what the board and the exec are doing. So thanks for sort of reminding us, Jonathan, in terms of that's going to be coming out. I think it's October, November. We're going to do a lot of comms around encouraging people to contribute. Is it going to improve? I think it's a really tough ask, given we're a year on, and we're all familiar, aren't we, with the real challenge of managing in what's a really difficult space at the moment. And I don't know, I like to be sort of positive, glass half full. I think we've done so much good stuff in the last year, but I don't know in the circumstances how that's going to translate into staff feedback comparing to last year. I think, to be blunt, I think everyone's a bit fed up with the pandemic, whereas a year ago it was all a bit new and unifying. I don't know what Anne-Marie, Lorraine, Sue's views are on it. Thanks. They haven't got views.
I'm doing a goldfish impression then, because it's one of those things, isn't it? We've been through some really difficult times, and I think John used a phrase the other day that I think really reflects that there's a very little resilience out there. Everybody's tired, and how that will all come across, because that's everybody from the chief exec, upwards and downwards and sidewards. Not putting John on the spot, but I've said to my colleagues at times, it all gets really overwhelming. Whatever job you're doing, you have those different pressures, but the same effects. And I don't know how that'll play out in terms of the staff survey and how people do genuinely feel, and when they fill it in, and whether things are getting better. But at the end of the day, I know it's a bit trite, but it is a journey. I know it's a word John hates sort of using, but it will take time, and having this in the midst of COVID over the top of it, I think the important thing is that people fill it in, and we saw such an increased response rate last time. And certainly, talking from a forensic point of view, I definitely had colleagues saying, we actually believe you're going to do something about what we tell you this time, and if we can get that, if that's how people feel, then that's an improvement in itself. So I'm going to stop because I could waffle forever.
I just wanted to add that I'm a massive believer that the more people that fill it in, it's more representative of the actual voice of the organisation. So I always worry if we have a very low response rate, because then you're responding to a very, very small minority, and it doesn't reflect. And I know some people get really cheesed off with me saying that, but honestly, it is about the response rates. And like Sue said, you know, if we can get that up, which we did so much better last time, we can get it up even more, then it really helps us to be able to know what to target and what to respond to. And we are really serious about taking it. You know, like, you need to know that some of us spend hours and hours and hours reading the comments to make sure, you know, like with our highlighters, and right, what could I put better in that area, and what can I do in that area? So we don't, it's not just something that's done and then we just cast it aside. Honestly, we do loads with it.
Yes, so I'd agree with that.
That's a really good point. So what John's, so I still get staff who don't believe that it's anonymous. I still hear that. And honestly, it really, truly, truly is. We haven't got a clue who's filled it in and who hasn't filled it in. And when you get your reminder, it's because the external company have got numbers. We don't know what that is. So the external company have got numbers. That's how they can send you a reminder. But we have no idea who people are that have filled it in.
So I would agree wholeheartedly with what Anne-Maria said there about we don't cast it aside. So I read every one of the comments that came in across my portfolio when I first started in the trust, and I fully intend on doing that. And for those that are in my team, they'll know I read them because I made them do something about it. But we can't do something about what we don't know about. Filling it in is so important. We do listen to it, we do read it, and it absolutely is anonymous.
No, thank you all. It's really interesting to hear your views on that. That's all the questions we've had today, John. So obviously, thank you to everyone for joining and for questions. If I hand over to you to conclude the session, John.
Yeah, thanks very much, Chris. Thanks everybody. That was good conversation. So some good challenging questions there in the chat. Thank you. Thanks to everybody once again for what you're doing. Tough times, and as we keep saying, it'd be nice to say, oh, and it's going to finish soon, but unfortunately I don't think it is, and we're prepped for a hard slog. But thanks again for today. Have a good afternoon, and see you all soon. Thank you.
Okay.